Another question, I guess, is, with COVID-19 patients nowadays, is there a specific template that all doctors will prescribe? Okay, ikaw, paracetamol. Lahat, paracetamol kayo lahat. Is it like that? Or is there a kind of paradigm for that, doc?
Sure. There's no specific regimen, no, or if we call it like a guideline in terms of the treatment of sore throat in COVID. It depends on the doctor, okay, and the doctor prescribing it, and at the same time on the patient. Okay, because majority of our patients, and I'm sure some of you might have self-medicated, which we avoid, no? We try to advise our patients to avoid. So for this particular study, the only regimen is to use difflam-c gargle. No other gargle solutions were used in this particular study. But as mentioned by Justin earlier, some patients receive paracetamol if they had fever. No, some receive usual cocktail and vitamin C, zinc. Some of you have heard about melatonin, no, all those stuff. No? So they're free to use all of those. But in terms of the gargle, it was only difflam-c solution that was used.
I noticed the melatonin. Is that so that they can go to sleep, so they can just relax?
Yeah, the melatonin is actually because what we want you to do if you have COVID is for you to rest. No? So melatonin actually regulates the cortisol level in your body. So in fact, in numerous studies, it's not the 3 milligrams, it's not the 1 milligram, but they're actually using higher doses of melatonin.
Really?
For COVID patients.
Interesting. Okay, thank you. And of course, for the throat pain, that was difflam-c.
Difflam-c.
Okay. Thank you very much, Doc, for that. Okay. Now, so that was the main treatment plan. Like, number one, we treat their throat pain, and if there are any other things that we need to treat, then we prescribe.
Yes.
Okay, so that's basically it. Okay. So I guess the next one is, how then did difflam-c help the patients of the study specifically? Can you tell us about the difflam-c regimen prescribed to the patients and the results of their recovery?
As I mentioned earlier, that they were at day 5, almost 70% of our participants have already resolved their sore throat, but for everybody, we asked them to still gargle with difflam for this until the end of the 7 days, because there are occasions where the throat pain will recur. So that's why for the interest of our study, we wanted them to continue taking the gargle for 7 days, because according to the prescribing information, it has to be taken uninterrupted for 7 days.
And at least once a day now, from days 2 onwards.
Yes.
Okay. I find that very interesting also. It's in day 1 that what's it, every 1.5 hours to 3 hours?
That's according in the prescribing information. You can take difflam from 1.5 hours to 3 hour
interval
for every day.
On day 1. What if it's very severe though? Like, for example, on day 2, if it's very, very severe still on day 2, can they take it more than once in that day?
No, you can take it with that in that dosage every day for 7 days.
As needed,
As needed. But for those people who already have their sore throat resolved, they didn't want to follow that regimen. So, but what we told the doctors is for them to advise them to still take difflam at least once a day for the next 7 to 7th day.
Okay, thank you so much for that, Doc. Now, as we pretty much established, effective siya, no? But I guess my question is, what makes it so effective for these COVID-19 patients? Any of the doctors?
Yeah. I guess let's go back to science. No? Talking about, because difflam-c is a fixed dose combination of 2 medicines. We call it benzidamine and the chlorhexidine. The benzidamine has 3 actions or 3 properties. It's anti-inflammatory, analgesic, and an anesthetic. And the chlorhexidine has an antiseptic activity. So going back to that premise, no other we call it medicated gargle, solutions will have that property. Will have those four properties, at least currently available in the Philippines.
No, none other. This is the only one.
As far as we are concerned, yes.
Wow. Okay. So you're combining these two molecules, I guess,
Yes.
these two medications, and so now you have this power-packed cocktail of fighting throat pain solution. Yeah. Okay. Very interesting. So it's the first.
Yeah, just as I mentioned to you earlier, just like when you take other multivitamins, in a bottle, you take it once a day, but you can also have like a tablet of vitamin C, vitamin B, vitamin A, zinc, selenium. Whereas if you take the commonly available multivitamins over the counter, it's the same thing. That's the fixed dose combination of different types of vitamins and minerals. Instead of taking several tablets in a day.
It's that fixed dose combination of benzidamine chlorhexidine. There you go. If you guys need to know, you can just read it over there and all around you, I suppose. It's a little bit of a tongue twister if you ask. Benzidamine chlorhexidine. Say that 5 times straight. I would love for you to make a TikTok out of that. No? But thank you so much for all of these, for all of these insights, docs. And what's nice is that this FDC that you say, the fixed dose combination, has been tried and tested, and we already have the experiment, we have the results of it, which I'm sure our difflam-c team would love to share with you as well if you request for it. But before we get to the next questions, we will be having a question and answer portion for you, our dear media friends. So if you have any questions, prepare them in advance. But right now, I guess, while our media friends are thinking about their questions, maybe we can talk about just throat care in general, doctors. What are some important habits to protect our throat health?
I probably would like to talk about healthy lifestyle in general. Not just throat care. We call it mask mouth. All of us. By the end of the day, we all have mask mouth already. Why? Because we were wearing masks all the time. At least for those who constantly use it. So that's the throat care. But we talk about also mental health, as mentioned earlier, and then of course the most important, the cornerstone is a healthy lifestyle. Meaning, you have to shower in the morning and in the evening. When you from here, I hope before you meet your family, you shower. Wash your hands. Social distancing is very important. Wearing your mask properly, as you can see in our mask, there's a metal here. So yung metal here, the aluminum is actually supposed to land here, not here. So you have to wear your mask appropriately. But if you are not in the hospital, I go to the hospital, that's why I wear an N95 whenever I go. But here, you can just wear your surgical or your cloth mask. Of course, part of this is gargling. Like for example, if you attend an event like this where you are close together, you might want to consider gargling your difflam-c. Or if you attend a party, or if you attend a wedding or something like that. But we discourage people to do gargling all the time, even if you're just by yourself, without any COVID. Now remember, this particular study was done for COVID patients with sore throat. But with the rising incidence of COVID now, I think we are on what? 6 ba? 6, 7, 8, 9, 10 surge na, hindi natin alam. So, if you are experiencing sore throat, or fever, or diarrhea, well, you should not go to work in the first place, or you should not attend meetings like this. That's why earlier, you were all given test kits to test yourselves before coming in.
Wow. I know, right? This is so much of it. But this is really our lifestyle now, Doc. You know.
Yes.
Like these are just the things that we have to adjust to on a daily basis.
New norm.
You know, I'm also curious about how many people said, you know what, boss, I'm not feeling so well today, I'll stay in na lang. I wonder how many of our friends have pulled that trick, you know? Don't raise your hand na lang. May baka sa Zoom you can do it. Di naman kayo kita, okay? Okay, so now we have, I think we can get to a couple of your questions from our media. Yes, can we have, I believe that we have some of them written down. Can we have the question, please? And also we have the mic in front, so if you would like to rise, just please state your name and to whom you're addressing your question to. Okay. It looks like we have one already. Hi, good afternoon.
Hi, good afternoon. I'm Ed Uy from UXLU. Just to clarify, you mentioned earlier na you could only use difflam if you're feeling those mild symptoms. Hindi siya pwedeng gawin just because you want to prevent COVID. Tama ba?
Okay. No, we are not saying, let's be clear. No? This study was done on COVID patients, suspect, probable, and confirmed case of COVID. No? So if you feel, because it's already community transmitted, meaning all of us here are suspects. No? When you say community transmission. So if you develop a sore throat, no? So technically you're a suspect. So you can use it. No? So as a treatment, that's not part of the study. If you get well, because there's no measurement of the viral load in your throat. When you say treatment, meaning at the beginning of the study, now we measured the viral load, no, your viral load. And then at the end of the treatment, we measure again your viral load. We did not do that. Now what we measured is the sore throat, no, the resolution of the sore throat. No? So if we measured it, no, meaning if this is a different study wherein we measured it, then meron siya in the beginning, for example lang, 100,000 and at the end, it's like 2,000, then you can safely say that it's curative. No, it cured it. No, but in this case, what happened is the resolution of the sore throat. No? I hope I'm clear in terms of the objective.
Follow-up lang is it best to use before you leave the house or once you get home na gagawin mo siya?
You can use it either way because depends on the trap. Kasi ito naman, di ba, the study, they said, we said, no, every 1.5 or 3 hours, no. So you can leave because it's a big bottle. No, it comes in 100, 200, and 500, no. So if you can put it in your bag, no, the 100 or the 200, then it's safe to carry it with you, no, and gargle before meeting here like this, no. Or you can just gargle before leaving the house, no? And I would like to also mention that actually difflam comes in several formulations, no? You have your difflam-lang without the chlorhexidine. That one will only have that 3 properties that I mentioned, which is not part of this particular study. This particular study is on difflam-c, no? So when you are going to buy, this is the pink one. This is not the green one, no? And then we also have the lozenges and the throat spray, no? The throat spray does not have the chlorhexidine. It only contains the benzoylamine. And the lozenge of difflam has a different antiseptic, no? We call it cyclopyridinium, no? Where in one study in Slovenia did a in vitro. When I say in vitro, it was not done in humans. Wherein they found out that it's effective also in the treatment of SARS, no? Not COVID, kasi COVID in men, no? Yung mismo virus is the SARS, no? So there's a study also in Slovenia that shows that it was effective, the lozenge yun. But our study that we did was on the difflam-c, the gargle.
Thank you, Ed.
Hello.
Oh, hi.
Hi, I'm John from Orange Magazine. Here, sir.
Oh, hi.
Apo. How fast was the recovery of COVID-19 sore throat of the patients in the study?
So I'll let Dr. Niles answer that.
How fast? There were some people as early as the first intake, they already had resolution of their sore throat. But what we wanted to highlight is that 70% of them had resolution of their sore throat on day 5. Because sore throat would normally last for 7 to 10 days untreated, but the intervention has shortened the duration of the sore throat. So if you think 5 days is long enough, but there were some who had resolution on the first 30 minutes of gargling.
Can you take it even before you have that sore throat? Once you have the COVID, of course.
This again, the limitation is in the particular study. You have to have the sore throat for you to use it. But of course, nothing can stop you from using it. No, if you're worried about it. No? After all, sore throat is a major symptom. No, if you have the sore throat, the fever, the diarrhea, no, those are the symptoms of COVID. But in this particular study, I would like to pull you back to the study. In the study, yung is for patients with sore throat already.
And is this safe for kids? And how old dapat po siya? Sorry.
For this particular study, 5 years old.
Yeah, we cannot give it for children younger than 6 years old, but we did not include children. So we only included 18 to 59, so just adults. But in their prescribing information, they are not they are not recommending that it will be given to children below 6 years old because of limited clinical experience with difflam-c.
Saka baka ma-swallow din eh. They might swallow it. Benzidamine is a weak non-steroidal anti-inflammatory agent. So if you are allergic to ibuprofen, mefenamic, aspirin, no, you might be allergic to benzidamine. So watch out for that. No, because if you keep taking it, no, and you are allergic to those components that I mentioned, then you will develop an adverse drug reaction. Yeah, because you're allergic to it.
Yeah, any side effects, sir?
Well,
Side effects, sir?
In the study, there were numbness because of the benzidamine and taste alteration because of the chlorhexidine. So those were the two common side effects, but there were other side effects which were actually in the literature, but those two were the top two adverse events.
But actually, the numbness is your goal. Remember, because it's an anesthetic agent, di ba? So, anesthetic, anti-inflammatory, no, analgesic. So, magkakaroon talaga ng numbness, and that's what you want because that's what you don't like, the sore throat. No? So,
You don't want to feel the pain.
yeah, you won't feel the pain.
Yeah.
I guess what the side effect in real world is if you're really allergic to the NSAIDs that I mentioned, then you will have side effects like blisters. No, you can develop acute hypersensitivity reaction to it if you're allergic to, as I mentioned, NSAIDs. No, yung mga ibuprofen, mefenamic, aspirin. No, marami yan, naproxen and all.
Thank you.
Thank you,
Hello.
Gerald. Oh, yes, go ahead.
Hi, I'm Candice from the Asian Parent. As a follow-up to his question, can people who are lactating women and pregnant women, can they take Diphthong?
We in this particular study again, no, we did not include lactating women, and we discouraged doctors to prescribe it to lactating women.
How about pregnant?
Pregnant is the same. Pregnant lactating women.
And also another question would be, is there like a proper way on how to gargle? I mean, I know it's like
It's a good question.
I mean, yeah, do you like swish it or do you like do the gargle?
Normally, when you gargle, you do like that, diba? No, you gargle for a couple of minutes. No? Swish is also the problem with swish is some patients they actually swish and swallow. Because there's another OTC brand wherein they actually advocate swishing and swallowing. So we don't want you to mistake it for that. No? So gargle talaga, not just because when you swish, you say this there, right? When you gargle, you have to like do that with your neck. That's why it's not recommended for kids less than 6 years old, because most of the time they will swallow.
Thank you. And Doc, I think if you're swishing, it's also hard for it to get to the back of your throat, right? So recommended is gargle. Yeah, okay. Thank you so much for your question. Actually, we also had a question from Jocelyn Valle of Smart Parenting via Zoom. It was the same question, pretty much. It was, is it safe for pregnant and breastfeeding? But I think we answered that already. Yes? Okay. Thank you very much. Okay, any other questions from, hello, yes.
Hi, my name is Angela. So, I have two questions. So, the first one is, in the near future, ba magkakaroon po tayo ng separate studies where difflam can also be a treatment for unvaccinated COVID-19 patients po? So,
Oh, gee, the drive of the government is to vaccinate everybody. No, so maraming
but there are still
so even if they are not vaccinated, they will be able to benefit from this, now from the difflam-c, if the goal is to relieve the sore throat. Yes.
Okay, so my second question will be, can we still use difflam as a self-medicated drug for COVID patients na getting their treatments at home?
Well, normally this is at home. No, this is because it's an over-the-counter medication. So anybody can buy difflam-c and then use it at home. Especially if you have the symptoms, and especially if you think you have COVID, or if you feel that you were exposed to somebody or a close contact of somebody who has COVID.
Okay, so the clarification here will be, just in case that you are allergic to certain chemical
And
products,
yeah.
yes, you are not allowed to get this.
Well, that's a special precaution. We call it special precaution, not actually an absolute contraindication. No? When you say special precaution, that means if you have hypersensitivity to some of the components of the medicine.
Thank you.
Thank you, Angela. Yes, we have another question. Hi.
Hi, good afternoon. A day from a day to remember. My question, Doc, is for the 7 days or for the 7-day treatment, what if you miss the at least 2 or 3 days? What will happen? Will you extend the duration because it's just 7 days, or how do you go about it?
Okay, so following the prescribing information, it's 7 days uninterrupted. So if you feel that you have missed some of the doses, you can extend. You can extend. But for our study, we just collect the data on them for 7 days. So if they miss gargling, it will just be recorded. It will just be recorded in their data. But for real world, you can just extend it because what you did was you interrupted it, right? You interrupted it.
In addition, I would assume that if you interrupted it, you were better, right? Because if you are not better, you will follow it by the hour. Yeah? So by the mere fact that you missed the dose, like for example, the afternoon dose, no? So I would think that you need not have the sore throat at that time. Or if you did, dramatically less as compared to when you first started.
Let me answer your question? Yeah. Thank you very much. Okay, we have another question from one of our Zoom attendants, Eileen DL. Eileen, we see you. Thank you, Eileen. The question is, if you're on the process of treating sore throat with difflam-c, can you just take lozenges if gargle is not available?
Okay. Dr. Jen is actually in the process of doing another study, no, on the lozenge, the difflam lozenge. So let me expand on that. Again, going back to my comment earlier, no, there was a study in Ljubljana, in University of Ljubljana, Faculty of Medicine in Slovenia by Dr. Andrei Steyer, wherein they used benzidamine cycloperidinium in vitro, no? Meaning in the laboratory, not in vivo. When you say in vivo on patients, yun, mimicking the mouth, no? mouth flora, no? And the conclusion was it is virucidal, meaning nabawasan kasi they were able to measure the viral load, no? So what we're trying to do here locally in the Philippines is actually trying to mimic that, but in terms of instead of in vitro, we're doing in vivo, meaning in patients, no? So to your question, we cannot answer that yet. If we can use lozenges, because we just finished the protocol, but hopefully we should be able to indirectly associate it with the slayers that I mentioned earlier.
Thank you very much. Any other questions from our dear guests? Hi.
Hi, good afternoon. I'm Jo Babutana of Manila Standard. Do we need a prescription if we are buying difflam-c?
It's an over-the-counter medication, so you don't need a prescription. Just like taking any vitamins, you don't need a prescription for that. The generics act require the ones we call it ethical. Ethical brands like antibiotic, antihypertensive medication, anti-cholesterol medications. Those they need prescription. But the other ones, like for example, difflam, or the others over the counter, you don't need a prescription for it.
Another question, sorry.
Go ahead, Jo.
If I feel like I'm coming up with something like a sore throat and I'm using a regular mouthwash, do I need to replace it, if I want to use the difflam brand?
As I mentioned, we are in a pandemic. So if you think you're coming up with something, you have to siguro evaluate, was I exposed to somebody who had sore throat, who has been sneezing, or a cough or cold? If you have been exposed, I guess it's going to be safer for you to take a medicated gargle instead of a regular gargle. Also, I'd like to also emphasize that ang gargle, all of these gargles, not just difflam, but majority of the gargles, meron siyang, it can kill or it can decrease the number of the good bacteria in your mouth. The dirtiest part of our body is our mouth, not the other one, not the mouth, dirty end. So there are normal bacteria in your mouth. If you keep on gargling on a regular basis, even if you don't have a symptom, then you kill that normal bacteria. So then, lalabas yung mga tinatawag namin opportunistic bacteria. Those bacteria who are not supposed to be there, they will go there. Kasi masyado mong tinanggal yung kumbaga collateral damage. Just like sa mga douche ng mga babae, every day, there are some women who douche almost every day. There's also normal vaginal flora. Na pag nagdo-douche kayo every day, without any symptoms, or no contact or anything, mawawala din yung normal bacteria na yun. That will be replaced by an opportunistic bacteria. The same.
Thank you, Doctor.
Masyadong malinis.
Mag-ingat tayo sa mga opportunistic na yun, di ba?
Marami yan.
Okay, we have another question in the back. Okay.
Just a follow-up question. Is that the reason why you should only take difflam-c for 7 days? Or not to kill all the bacteria?
For this particular study, yun yung qualifier for 7 days. But we would assume that if you have taken it for 7 days, and hindi siya nag-work, it might not be the right gargle for you, because kung yan a fungal infection, for example, you are a chemo patient, or you are you have other HIV patients wherein they have other mouth sores, no, then it's not probably going to work for you. You really have to consult your doctor. No?
Thank you very much. Any more questions from our media guests? Or even from the participants of your live streams? Hello to our live